Hi, everybody. Thanks for the invitation to share this work with you. I have not been to this conference before, and this is actually one of my first experiences working with panel data, and it was really positive, and I wanted to share um, our experience with this and the impact we felt like it had in LA County. So I'm focused on the benefits of collecting food insecurity data with a high granularity in LA County during the pandemic, and how this was particularly useful for the local stakeholders that we were working with. I'm working as part of a really big team at USC, at CUNY, our public exchange partners, which help us work with government and local organizations, and our partners in the county government, the LA Food Policy Council, and partners we had in community-based organizations and other data sources. So in LA County, we saw really massive disruptions to the food system, to many different aspects of it really quickly as the pandemic hit. Unemployment in LA County hit 20% really quickly. Folks lost their jobs and incomes. Low-income residents who rely on things like school meals or meals from churches and other faith-based organizations or senior centers, many of those were shut down or hard to get to. We saw food outlet closures, especially small businesses were going out of business or shutting because they were ill. And there was a lot of restrictions on retail food outlets put in place by the county to try to restrict transmission of the disease. And at the same time, food prices were going up, inflation started kicking off. We saw shortages of food in LA County at different periods of time because of disruptions to the food supply. And on top of all of this, a lot of the families we worked with talked to us about how scared they were to take their kids on a bus to try to go get food, especially if they couldn't afford food delivery. So this is sort of the context of everything that was happening. I was working at the time on an intervention with low-income moms and their young kids through home visiting programs, and we were working with them on building healthy eating habits, filling your plate with fruits and vegetables and things like that. Every single family in our trial became food insecure within the first couple of months of the pandemic. And the community partners we were working with were in crisis mode. They had these enormous lines they have never seen before at food pantries. There was all these pop-up food pantries. There was just huge numbers of people trying to get access to food. And we didn't have any data in LA County about food insecurity. There was no current data on what the rate of food insecurity was. The last data that the county had put out was from 2018. And national data that was coming out was telling us that food insecurity rates had stayed flat, both nationally and in California. They weren't reporting any spikes, which obviously just didn't jive with anything we were experiencing locally. So just to clarify, when I'm talking about food insecurity, what I mean is disruptions in food access and regular eating because people have limited money or other resources. And what that really means for people is that they're eating less, they're skipping meals, or they're going for a full day or more without eating. In other words, they're hungry, they're stressed, and this actually has really negative impacts on their nutritional health and risk for disease. In a typical year in the US, 1 in 10 households experience food insecurity. And so this is sort of the baseline that we're working from. So what our challenge was in LA County was that food insecurity is typically monitored just every 3 years. The last time they captured this was in 2018. About 1 in 10 households were food insecure. And usually they only monitor this among low-income households and focus on pretty narrow indicators. So they're measuring food insecurity, but not all of these upstream drivers that were really changing in the food system. So we just lacked sources and options for a lot of local granular data. And so we were working with our county partners, and our goal was to try to gather more in-time granular information to give us a better insight about what was going on locally. So our driving research questions were, first, just to establish what the impact of the pandemic was on the rate of food insecurity in the county, and to try to better understand what strategies were working and what was still needed to address this. And so I've mentioned a couple times this was really a project that was a partnership with a number of entities, in particular the LA County Board of Supervisors had set up a food security task force. They were charged with monitoring and addressing this issue. They had millions in resources to allocate, but they had very little information to make decisions about what to do, as did some of the other community-based organizations like the food bank, trying to make decisions about how to scale up and where to put their resources. So we drew on a number of data sources for this, and a key one was the Understanding Coronavirus in America Tracking Survey and subsequently the UAS data. And we leveraged this survey and the rich data it has in LA County and the large representative subsample it has for the county to quickly gather data on food insecurity and a number of other risk factors and food-related behaviors that we wanted to try to understand. And then we paired this with data, big data that we got from Yelp about the retail food environment, data from county government on things like enrollment in food programs, and data from other community partners like the food bank. And so what we found from the panel survey was that 1 in 3 county households experienced food insecurity between April and December of 2020. This is about 1.2 million households. And historically, the county has just tracked food insecurity among low-income households below 300% of the federal poverty line. And so what we really wanted to do was compare to what the data they had in the past, and we see this huge spike. So prior to the pandemic, rates of food insecurity among low-income households had been 31% and down to 27%, and we see it shoot up to 42% in this first year of the pandemic. So a lot higher than rates historically. The other immense value of using data from the panel is we had all this other information from these folks about their demographics, which benefits they were receiving, and we knew a lot about them, so we were able to quickly profile who the folks were that were experiencing food insecurity. The majority of them were female. They were younger adults, low income as expected. We saw rates 2 times higher among Latino and Black residents compared to white, and higher rates among immigrants. And using multivariate models, we were able to identify some key predictors of food insecurity during this time period, which we thought might differ to what historically has driven food insecurity given all of the changes in the food system. Some of them were very expected, low income, having become unemployed. But going into this, the county was really worried about older adults and folks 65 and up, and they had started funneling a lot of resources into that. We didn't see any rise in food insecurity rates among that population for a number of reasons, some of which might be that they didn't have shifts in their income, but also because a lot of resources were getting directed to them already. But we did see huge spikes and highest risk among younger and middle-aged adults who have dependents, who may have had other financial challenges with job loss. So some of these were new predictors that really helped the county understand who was most at risk and vulnerable and where they should be directing. We did a fair bit of evaluation on what was helping folks alleviate food insecurity. People were using a whole bunch of different resources for food assistance. They were getting help from family and friends. They were using their stimulus money. They were going to food pantries, and they were increasing their enrollment in government food programs like SNAP. We did an analysis over the 2020 year using data that was captured every 2 weeks from this panel, and found that those folks who received SNAP, that's also called CalFresh in California, previously known as food stamps, were significantly more likely to transition from being food insecure to food secure over that year. But we could also see from this panel that just 1 in 4 folks who were food insecure were actually enrolled in getting these benefits. We saw the immense value the charitable food assistance programs were playing, and that a lot of folks were using this. And the quote here is from one of the UAS panel participants who had experienced food insecurity through 2020 and 2021, talking about how valuable the food banks were and how they helped them get food that they needed for their children. I mentioned that, so one of the other values of the panel is having this geographically representative group of folks that we can start to link their data and where they live to other information about the food system that we were interested in. So we were able to look at things like We know that 1 in 4 LA County residents live in a food desert where they have limited access to affordable, healthy food through grocery stores. And through data that we got from Yelp, we were able to evaluate that 17% of retail food outlets had temporarily closed in the year 2020. And by linking the panel survey participants based on where they live to some of these geographic information, we could see that those folks with recurring food insecurity were more likely to live in a food desert and had greater difficulty accessing food because they felt like stores were closed or they had a hard time getting there with transportation. I'm going to skip that slide because I'm getting to the end. Yeah, maybe not. The last piece, we partnered with the food banks as well to try to get a picture of the landscape of food assistance and food pantries in the county. And again, we're able to document where there was this double burden of being both in a food desert and a food assistance desert, and start to look at the intersection with panel participants and their experiences of food insecurity with living in these under-resourced neighborhoods. And this was something that was really valued by the food pantry partners in thinking about where they direct their very limited resources. So one of the things I really wanted to share with you all is the value of this information to local folks working on this issue. We put out that year, I think 6 or 7 reports, short briefs and some longer reports documenting just these basic statistics. And the statistics of how many folks were food insecure and who was food insecure was cited by the food pantry in their fundraising. It was cited by the Board of Supervisors. It was cited by the mayor and put in a whole bunch of policy motions that ended up redirecting a lot of resources to this issue. A lot of the data we shared with the Food Security Task Force really helped them allocate the millions of dollars of ARPA money that they were trying to spend and think about which programs they wanted to funnel it into. And we ended up sharing sort of the framework for all of this at the White House's Conference on Hunger and Nutrition last year. And what this has led to is this really productive partnership between our research team, local government, and they've used a lot of the data that we've brought in to make the case for a food equity office within LA County to address all of these issues. They formed a strategic plan to transform our food system and reduce the risk for folks for food and nutrition insecurity. And we have continued to work with them, partly through support through an NSF grant, to continue gathering this data, including the panel data, and integrate that with a lot of other layers of information and data about the food system into a dashboard that policymakers and local organizations are now starting to use. So where we are at now is sort of the same part of the story where we started from. We have continued to track food and nutrition insecurity in LA County through the UAS panel. The graph that you see on the right actually shows that we did a great job helping folks recover in 2021. All those benefits really helped. And then as the benefits started to get repealed and food prices continued to go up and inflation went up, we have seen spikes now back up to the same level of food insecurity in LA County. And contrast this with the state and California data, which showed that food insecurity declined in California in 2020 and 21, and only just this last year have they reported an uptick. So it continues to be really valuable to have this granular look at the county. And some of our recommendations have really been to think about growing our capacity to be nimble, especially when things are changing quickly and differently within one city compared to other locations, to collect this sort of granular data. And I think the other thing I wanted to leave on is we've seen such a contrast in who values this data. So this data has been immensely valuable for local decision makers. But when we've gone to publish these studies or do put out work in the scientific space, often we'll get comments saying like, this isn't really generalizable, it's a case study. And so it's brought up an interesting tension for us for translational science. What work is valued and what is invested in terms of data collection. So I'll leave it there.